When the thymic hyperplasia is not so significant, it can be a little difficult, as here the thymus is seen enveloping the vessels. It goes from medial or from right to left. But again, when you look at the coronals, you see the sharp edges and the lobulated appearance and the arrow-shaped appearance, and this is clearly a thymus. Now, this is the way in which how the thymus looks with increasing age, and we should be aware of this. Remember, the thymus doesn't grow. So it's the largest single structure in the pediatric population, and then as the body grows, the thymus remains the same, and therefore it becomes smaller and smaller until after about 17, 18 years, you actually start getting atrophy and fat infiltration. The other variant that you would see is the presence of tortuous vessels. These present with superior mediastinal widening, and very often in the elderly, a CT scan gets done because the radiograph would show superior mediastinal widening, and all you see is tortuous innominate vessels like this. Now, when it's a vascular pathology, as we see here, and there is an aneurysm, and you saw this on the radiograph, it's very easy. There's no further thinking, because that mediastinal mass being an aneurysm is obvious once a contrast study has been done. So there's nothing more except for knowing how to read an aneurysm. But the challenge is to differentiate lymph nodes from masses. So nodes are discrete. They are multiple, usually in specific locations, usually less than 5 centimeters. If they're greater than 5, then it's almost always lymphoma. And they display structures. Masses are often ill-defined. Of course, the mass is a cyst, like a bronchogenic cyst. It will be well-defined. They're usually single. There is no specific location, but that's not really true, right? So I also told you that you could have a thyroid mass. It will only be in the area of the thyroid coming down. It will be in the anterior mediastinum. Or a neurenteric cyst will necessarily be in the posterior mediastinum. So in that sense, they have specific locations, but like lymph nodes have stations, right? Specific areas where they occur. Masses can occur in that sense randomly. They're usually large, and they may, if they are malignant, encase and infiltrate, right? So here you have different lymph nodes, and these are the different areas where we get lymph nodes, subcarinal, para-aortic, etc.